Marty Makary, Blind Spots, When Medicine Gets It Wrong, and What It Means for Our Health. Dive into a gripping exploration of how the medical field's well-intentioned but misguided practices have shaped public health over the years in Blind Spots, When Medicine Gets It Wrong, and What It Means for Our Health by Marty Makary. This summary reveals startling insights into the surge of peanut allergies, the overuse and misapplication of antibiotics, and debunked myths surrounding cholesterol and heart disease. As you journey through these pages, uncover how updated medical understanding is slowly replacing outdated authoritative guidelines on childbirth, silicone implants, and even the use of marijuana and fluoride. Packed with real-world examples and research-backed evidence, this book challenges you to rethink the blind adherence to medical advice and emphasizes the importance of staying informed for the well-being of you and your family.
Peanut allergy paradigm. In the late 1990s, peanut allergies affected a mere 0.6% of children in the U.S., a rare occurrence that found itself transforming into a widespread concern by 2004. With peanuts being banned in schools and emergency rooms filling with young allergy sufferers, the mystery deepened. How could such a phenomenon occur in the U.S. while remaining uncommon in regions like Africa and the Middle East? Back in 2000, the American Academy of Pediatrics advised parents to keep peanuts away from children under 3, intending to safeguard them from allergies. However, this well-meaning suggestion was built on shaky evidence, contradicting critical immunological insights. Experts like Dr. Rebecca Buckley argued that exposing young children to potential allergens could foster immune tolerance, thereby preventing allergies. Nevertheless, the AAP's directive became widespread among pediatricians, who urged parents to avoid peanuts for their infants. In the face of this trend, Dr. Stephen Combs, a Tennessee pediatrician, defied the norm by recommending early peanut introduction, drawing on Dr. Buckley's research. His patients showed no signs of peanut allergies while cases surged across the nation. Immunologist Dr. Gideon Lack provided further evidence against peanut avoidance, noting the stark difference in allergy rates between Israeli children who enjoyed peanut snacks and their British peers. His 2015 clinical trial solidified this theory, showing an 86% reduction in allergy risk from early peanut exposure. The lingering effects of the AAP's earlier recommendation led to a generation plagued by peanut allergies, inducing anxiety and constant vigilance among families. Even with a reversed guideline, many parents remained hesitant, unaware of the shift. As a parent, it's crucial to stay informed, evaluate health advice critically, and embrace scientific advancements, especially when they could protect your child's future. Antibiotics Unmasked. Imagine Chris, a teenager caught in the throes of chronic stomach pain, yet no doctor could find the root cause. Delving into his medical past, the problem reveals itself. His microbiome, the vital ecosystem of bacteria in his gut, had been thrown into chaos. Repeated courses of antibiotics had wiped out beneficial bacteria, leaving him vulnerable to inflammation and imbalance. Chris's story is a common tale of how antibiotics, often perceived as harmless, can disrupt the delicate harmony within our bodies. The overuse of antibiotics is a pressing concern. Alarming statistics show that nearly half of all antibiotics prescribed in the U.S. are unnecessary, frequently given for viral infections antibiotics can't treat. This overprescription not only fosters antibiotic resistance but also dismantles the microbiome, which plays a crucial role in digestion, immune response, and mental health. Patients are often told that antibiotics come with no downsides, yet about 20% of hospitalized patients treated with antibiotics encounter adverse effects like kidney damage or more severe complications. The impact of antibiotics is even more profound in children. A study by the Mayo Clinic, tracking over 14,000 young participants, discovered that children given antibiotics before turning 2 faced increased risks of chronic issues such as obesity, asthma, and learning disabilities. Each course of antibiotics amplified these risks, suggesting a direct connection between early exposure and long-term health repercussions. While antibiotics are vital for combating severe infections, it's crucial to recognize their risks and avoid unnecessary use. The collateral damage includes harming your microbiome and worsening the antibiotic resistance crisis. Consider the pros and cons critically, and don't hesitate to question the necessity of antibiotics for you or your loved ones. Outdated diet myths. Uncle Sam's life tells the cautionary tale of outdated nutritional beliefs. For decades, this 93-year-old avoided his beloved eggs due to warnings in the 1970s about cholesterol clogging up arteries and shortening lives. This advice, rooted in the work of Dr. Ansel Keys and the flawed 7-country study, long influenced public health messages and guidelines, convincing many to adopt low-fat diets. However, emerging research reveals those warnings were unfounded. Numerous studies, including a massive 2020 study involving 177,000 participants, have shown that consuming eggs and cholesterol-rich foods does not elevate blood cholesterol or increase heart disease risk. Contrary to past claims, cholesterol is vital for maintaining cell structures and hormone production. The persistent myth prioritizing low-fat lives over truth has taken root in popular culture and healthcare circles, affecting countless individuals like Uncle Sam. Instead, modern understanding highlights inflammation, fueled by refined carbs and sugars, rather than dietary fats, as a more significant factor in cardiovascular disease. Given this insight, reconsider any advice to shun cholesterol or fat, and embrace whole foods, sensible portion sizes, and reduced intake of refined carbohydrates for optimal heart health. Uncle Sam's newfound enjoyment of eggs embodies the liberating power of dispelling outdated medical myths, paving the way for a more satisfying and healthier life. Embracing natural birth practices. In the mid-20th century, childbirth took a clinical turn, with hospitals prioritizing swift interventions and detaching newborns from their mothers immediately after delivery. This method favored medical technology over the body's innate processes, but modern insights upend this approach. Some widespread practices, like rapid cord clamping and newborn separation, were believed vital for infants' health. Yet, recent studies reveal that these methods may cause more harm than benefit. Consider delayed cord clamping, where the umbilical cord continues supplying oxygenated blood and vital nutrients for a minute or two post-birth. This method, once neglected, has shown remarkable advantages, such as reducing the need for transfusions in preterm infants, boosting oxygenation, and fostering better neurological development. Although increasing in prevalence across U.S. hospitals, the haste to clamp cords was once standard. An additional transformation involves the encouragement of skin-to-skin contact between mothers and newborns immediately after birth. In past decades, separating babies to sterile nurseries was the norm. However, current findings underscore that mother-infant closeness, especially skin-to-skin, stabilizes the baby's heart rate, temperature, reduces stress hormones, enhances breastfeeding success, and lowers the odds of maternal postpartum depression. Leading the charge in these neonatal care advancements is Dr. Arpita Karovalu from Baylor University Medical Center. Her advocacy has brought attention to how delayed cord clamping and skin-to-skin contact significantly improve outcomes for mothers and infants. Such natural practices result in shorter NICU stays, fewer interventions, and healthier babies. As childbirth reverts to methods that honor the body's natural flow, a harmonious blend of essential medical interventions and natural bonding experiences is emerging. This evolution invites a kinder, healthier welcome for new lives entering the world. Silicone Scare Saga. In 1990, the nation was gripped by fear when a television report by Connie Chung spotlighted the potential dangers of silicone breast implants. Women sharing stories of debilitating symptoms like pain and fatigue fueled a widespread panic. Despite scant scientific evidence, these accounts prompted a significant health scare, leading to extensive litigation and a 1992 FDA ban on silicone implants. As women hurried to remove their implants, they faced emotional and financial turmoil, deepening the sense of crisis. The decision by FDA Commissioner Dr. David Kessler to ban the implants was a reflection of broader apprehensions about cosmetic surgery and was based more on anecdotal reports than solid evidence. This event sparked intense debates among doctors, patients, and the legal system about the true risks associated with silicone implants. As the frenzy continued, studies came to light, challenging the purported link between silicone implants and autoimmune diseases. By the late 1990s, research conducted by the Mayo Clinic and the Institute of Medicine found no connection between silicone and the diseases in question. Although the FDA ban was lifted in 2006, the lasting impact of this controversy had already been felt, bankrupting companies like Dow Corning and reshaping public perceptions of breast implants. During this same era, the lax approval of opioids like OxyContin by the FDA highlighted a stark regulatory imbalance. While scrupulous in examining breast implants, the agency failed to apply the same scrutiny to opioids, contributing to a devastating epidemic. This contrast underscores the perils of misdirected regulatory priorities, where unfounded fears can eclipse genuine health threats. Currently, silicone implants are deemed safe, but the historic controversy serves as a stark reminder of media influence and the necessity for decisions grounded in evidence-based medicine. Challenging medical dogmas. A few decades ago, a dangerous oversight in medical understanding led to tragic consequences, exemplified by Bob Marley's early death from undiagnosed melanoma. Misconceptions like this remind us that accepted medical truths can be flawed. This real-life case compels us to scrutinize other long-held beliefs in modern medicine. For instance, the use of fluoride in drinking water has long been touted for its cavity prevention capabilities. However, recent studies question its safety, with findings in 2019 linking higher maternal fluoride exposure to lower children's IQs. Additionally, much of the supporting research is outdated, often originating before 1975. Nations in Europe without water fluoridation have experienced similar reductions in dental decay, prompting a re-evaluation of fluoride's true benefits and potential risks to health, including its effects on the microbiome and brain function. Another unquestioned belief is the harmlessness of marijuana. The drastically increased THC levels in today's strains raise concerns, particularly regarding adolescent mental health. Evidence points to heightened risks of schizophrenia, depression, and suicidal tendencies. Moreover, marijuana usage has been associated with cardiovascular issues like heart attacks and strokes, urging a reassessment of its safety as a recreational substance. In hospitals, the automatic use of Tylenol to treat fevers also merits reassessment. Fevers serve as a natural defense mechanism against infections, and immediate suppression may inadvertently prolong illness. This understanding suggests we should revisit the routine suppression of fevers with medication, potentially allowing the body's natural responses to play a beneficial role. These considerations highlight a fundamental challenge within modern medicine, distinguishing between firmly established facts and entrenched opinions. As science progresses, remaining open to questioning and revising medical practices is crucial to avoid repeating the mistakes of the past and ensuring health recommendations are truly evidence-based.
As you reflect on the blind spots, it's clear that questioning and evolving from established medical practices can bring better health outcomes. From early allergen exposure reducing peanut allergies to debunking cholesterol's impact on heart disease, the book encourages a shift towards evidence-based medicine. By highlighting the overprescription of antibiotics and the outdated fear of silicone implants, Makary urges critical assessment of medical guidance. The overarching message is profound: stay informed, challenge outdated recommendations, and embrace new scientific insights to safeguard your health and that of future generations. This journey through medicine's blind spots reminds us that progress lies in questioning past assumptions and adapting to a better, healthier future.